Hey, welcome to another segment, of Unscripted. We're here with James and Eric. Sorry, James, I stepped on your feet.
Well, you all tongue tied over there because you
No.
drinking that new coffee over there. You probably shouldn't be drinking. You're supposed to be drinking that lactose free. I'm gonna put you out there on Front Street like
Yeah, I
that. But
know, I know. Yeah.
Eric, you got a good show, man. And I say you because today is focused on some activities that you're working on, and I think it's a message that needs to be shared. So I'm just really going to produce today, and I guess before I go off camera, tell the folks in terms of what the message is going to be about today.
Well, the message is, well, as you all know or don't know, the open enrollment is around the corner. And what I want to do is maybe go over some things about Medicare because as us not millennials, but as us baby boomers are starting to get closer to that age or at that age, 65, we want to know more about Medicare. Everyone, and I want to maybe dispel some myths out there. So I have some guests on today. I got some experts in this field that can educate us on Medicare and what that means during this open enrollment period coming up. James, you want to bring them on? I got Ed Casasola.
Thanks for having me.
Yeah, definitely, man. Hey, welcome. Thanks for joining us. Like I said, we're going to be talking a little bit about Medicare. Can you give us an idea or what is Medicare? We hear all this stuff about Medicare Advantage. Can you kind of explain what that is?
Yeah, so Medicare is basically it's federal funded. So someone will get Medicare when they participate working for 10 years. So you'll get that automatically Part A when you turn 65. However, there's some people that will work 10 years and become disabled after 24 months. Permanent disabled, Medicare will grant them Medicare.
Oh, I still haven't said that. So what we're talking about now is an automatic enrollment when they turn 65. Is this correct?
Yes.
Okay. And what he's saying is, and this is what they're actually calling original Medicare, straight from the government, correct?
Basically, yes. The Medicare is you will have A is hospital, B is outpatient. So Medicare will give that to you when you turn 65. However, Medicare will cover you 80%. So there's going to be a 20% gap on those. And what you need as a baby boomer, if you're turning 65, you need something to cover the 20%. So what the government did is had contract with the some of the big carriers like Anthem Blue Cross, United Healthcare, Humana, Blue Shield, Scan. These are big companies that's been around. Aetna. So basically, they have created what they call a supplement plan. So
Mm-hmm.
there's different type of plan. There's a supplement plan that you can go to any doctors you like, any specialist anywhere in the United States, or you could choose the most plan that people would use now is the low cost, very effective plan, which is a Medicare Advantage. It's a zero premium in California, here in Southern California. And a lot of the people would say, if my doctor is in the plan, my hospital is in the plan, my specialist in the plan, why would I pay? So it really depends. You have different audience of what they like. You, as a broker, you would have given them a chance to what fit them
Mm-hmm.
by talking to them, asking them questions, and do your analysis by talking to them and doing your thorough analysis with any of your clients.
I'm glad you brought that up. So we'll talk about some of the benefits of that. It looks like you brought another guest on with you. Let's bring on John. Let's talk to John D. Hey, John, how's it going? Thanks
Morning.
for being on the show.
Not too bad. Got my dog
So
jumping on me here. Sorry about that.
that's okay. Tell us a little about what you do and what's your background.
Yeah, so Eddie and I go way back. We used to work together at a health plan, and decided to get into this business. But part of my job description is to be one of the compliance officers on the hey, on the with the agency. So with that, we got to make sure that all of our agents
Sounds like he's
are,
trying to keep you compliant.
yeah, we got to make sure that all the agents are compliant, and utilizing all the. I apologize.
That's okay. That's okay. He's keeping you on point. He's trying to keep you compliant.
I know he's a handful. But and again, just going back to the compliance, we got to make sure we're up to par with the CMS, the government standards, the procedures that we need to follow as the agency. And we got to make sure that all of our agents are following all the guidelines to make sure that they are, first and foremost, are eligible to practice and be practice to be able to sell the Medicare.
Awesome. So Ed, let's go back to you're talking about Medicare. You said Part C, and there are some advantages. Are there disadvantages and advantages of being of going into you spoke about it being zero premiums in California. Talk to us about some
Okay.
advantages.
So one of the advantage on the Medicare supplement is you are able to go to a doctor, whether it's in another state or another county. So that's a Medicare supplement. So they have a different type of Medicare supplement. There's Plan G, Plan F, Plan K, what have you. There's different kinds. And then you would have to pair that with Part D, which is prescription drug plan. However, since I've been in this business for 20 plus years, John and I had seen a lot of the seniors when they looked at the plan, a lot of them on the fixed income, like myself, I'm on the fixed income. Mm-hmm. Seniors wanted to look and see what the value of the zero premium. The Medicare Advantage had gone really above and beyond what Medicare had provided. So they had now provided for transportations. They also provide gym membership for the zero premium. They also have transportations. They have OTC, like you could get some vitamins, acupuncture, chiropractor. There's so many values on that zero premium, and they now also take it to a different level. So they also have now Fitbit on some of the OTC benefits.
That's amazing.
To make the seniors really active, what the value that brought to that benefits, it's really above and beyond what Medicare, original Medicare will give. My mother and my father is in the plan, and so is John as well, his mom and dad. But what really the Medicare Advantage is the coordination of benefits, and also not only the health plan is watching and doing their best to make the person healthy, and also the medical group are working together, making sure that you're doing your preventative, you're getting the checkup on time, and they're following up with you constantly just to make sure that you're getting your service. And they constantly checking and see if there's anything that you need. John, you want to add something to that? John?
No, you've hit it on the spot there. Can you hear me? Yeah.
Yes.
So going back to Eddie saying, we just got to make sure that we identify the needs. First and primary is to identify the needs of the members, right? So we got to make sure what their capabilities are, if they're incapacitated, do they need transportation? Yeah. Do they need if they've got a chronic condition, if they're diabetic? We have to identify which plans would suit them for their particular chronic condition, whether it's diabetes or they're having any heart conditions, if they're having any or if they're asthmatic, then we can identify those particular carriers that specialize in these chronic conditions. So it's not just hey guys, I know you're turning 65. Let me go and sign you up with a Medicare plan, not knowing what their conditions are, not knowing what their needs are. So it is imperative that we make sure that first sit with the members, identify what their needs are, and then write up a plan or identify a plan that would suit them. This is for, they're, just because they're turning 65, enrolling them into a suitable plan, that means basically you're looking at 15 to 20 years of their life being able to stay with a particular plan, right? So, because you don't want to keep switching members back and forth from one carrier to another carrier, right? It's not conducive to make it's to the benefit, the members' benefit, that we make sure we put them on the right plan. It's not all about the renewals or the sale that's the agents are going to be receiving from this enrollment, because it can come back and bite you at the end of the day. That you're going to get complaints from the members. Hey, why did you enroll in this plan? I told you, blah blah blah. I'm diabetic, whatever the case may be, and you're looking at a compliance issue here.
Thanks, John. I'm glad.
On the what does Medicare not cover? Oh, so that's a good question. Would you like me to answer that?
Yes, please.
Eric? Okay, so Medicare does not cover dental. Does not cover the vision. So some of the gym. These are some of the cosmetic. What Medicare think is cosmetic. So dental, visions, acupuncture, gym. Medicare treat these as cosmetic. So what the plan really has researched, what would really help the seniors is by getting them in the morning, going to the gym, to a Zumba class, to a gym that they could go and have social life, do yoga, do Zumba, what have you. I think the Medicare Advantage plan had done really well for many years, and that's still doing great. It's being enhanced every year. It's getting better and better. John, you saw it when we were starting this industry. It's just it's get better and better.
Mm-hmm. So I see we have another question on Barb.
Exactly.
I want to get to that. However, let's I want to be able to separate the two, and because when we say Medicare and then Medicare Advantage, when we're saying Medicare, we're saying when it's not covered. You're talking about not covered in original Medicare, correct?
Yes.
And therefore, that's why they've created plans or providers have come up with a solution, which is the Part C, that allows you to possibly have those other, what they call deemed cosmetic, correct?
So, John, you want to answer to that, John?
There is a fine line between the original Medicare and Medicare Advantage, right? So, as Eddie alluded to, it depends on, and again, going back to the seniors, what their needs are. If they are financially capable of being able to enroll in Medicare supplement, because that's another part of Medicare that's we haven't touched on. But original Medicare is, and again, is just you're entitled to original Medicare as long as you meet the criterias through Medicare. But with regards to the Medicare Advantage plan, that's another health plan type. It's part of the original Medicare. It's what we call Medicare Part C, and that allows additional benefits that may be offered to the members that original Medicare doesn't provide. So, and then again, it's just what the needs are, and based on that, we would be able to enroll them in the type of the Medicare plan.
So on top of that, John brought good information. What really happened is it's an 80-20 with Medicare. So you have 20%, and that 20% could be very, very costly. Let's say a senior went into a hospital for a couple of days. So a 20% of 100,000, that's easily 20,000. So if an average senior that only had done an average Joe job didn't have so much savings, that would drain his savings already.
Hmm.
And that's dangerous. And that's really, really important when, you know, people, when they get Medicare Advantage, they're really confused on what they need to do. And some of them get late penalty and because they just don't know how to do it. What we do is really we talk to them and educate to them and ask them really what the needs are so we can meet those needs.
Gotcha.
Uh, and thank God for Medicare Advantage and Medicare Supplement because they went above and beyond the what Medicare had provided until now. So there's a question here: what if already a health plan insurance through their employer? Do they have to enroll? So if they are 65 and they are working, they don't have to. But since we've been doing this for many years, so we've been watching it closely that some employers they do have coverage for their people that work for them 66, 67. However, the deductible is very huge and it costs the employer. So there's a pretty cost amount of deductible, co-insurance is high, copay is high. So if you look at it and compare it apple to apple or compare Medicare plan versus to employer plan, most of the time what I notice in my experience, the Medicare plan is always the route to go to.
Gotcha.
But we always sit down and say, you know what, bring your employer plan and let's compare it to the plan that you're going to have. And a lot of them does not cover what the other plan will cover. So it depends on the size of the company too, who they work for. So it really depends on what coverage they have with through their employers.
Thank you for that. How about let's since we're going into talking about who gets what and who's eligible, let's talk about eligibility. Who is eligible? I know we talked about being 65, but who is eligible for Medicare? Is it just being 65?
I'll have John could answer that for you. John?
Yeah, so the criteria are you have to have X amount of quarters works, right? Roughly about 10, 11 years that you have to have paid into the system. You also have to be a U.S. citizen or what we call what's the word I'm looking for, Eddie?
Permanent residence.
Permanent residence, correct, of a state that you reside in. So, and also you got to make sure that when let's see, but if I'm not sure if I'm missing anything else, Eddie, but I believe those are the criteria that are required to be able to be eligible for
40 quarters, 10 years of
so-
work normally, and permanent residence, 40 years, 40 credits. As long as you make that, I had a client who's under 40 years old, and he was a mechanic, and the car landed his chest, and this thing can't work anymore.
Mm-hmm.
Right side of the arm and everything, it's just destroyed, and the doctor claimed he's permanent disabled, so he was granted Medicare.
So it sounds like there's a process that we of not process of elimination. What's of being able to find maybe a guideline or criteria. I guess to do that, you would want to go to an agent and probably find out more information. John, you're in compliance. I know you have to be a licensed agent. I know there's a lot of times there's a lot of folks, elderly that get taken advantage of. What is the best? How can someone understand more about the licensing or find a licensed agent? Can they research licensed agents to make sure that they're qualified to give them advice about Medicare?
They can, but I would say start off with Medicare.gov. So that would be our Bible, right? For anybody can go into the Medicare.gov. And a lot of the questions that they may have can be answered at the Medicare.gov. But regards to looking for an agent and identifying if they are, have a valid license in states, there is websites through the state of California. It's the California.gov websites, and you can look up any agents or any members, people that you feel you want to take a look and see if they have a valid license, and that's open to the public. Anybody can go in and type in their last name,
Right.
first name, and it will show their active status on the websites. But with any other questions regards to Medicare, I would advise them to utilize Medicare.gov websites, and they can learn a lot of more information about Medicare, original Medicare supplements. If they need to, if they're thinking about, hey, I think I need to sign up with the plan, they can go directly to the Medicare.gov website and plug in their zip code, and it would identify the plans that they can search, whether it be the Medicare supplement plan or an MAPD plan, and then and utilize an agency that would be able to provide them the agents to reach out to them.
Awesome.
We got a question here. It says, what if you're not 65? What certain circumstances can qualify? That's a good question. That would be ESRD. That's another one, which is end-stage renal disease, disabled. That's pretty much basically what it is, those two categories.
Okay, so looks like we have another. How about, can veterans change their TRICARE to Medicare Advantage plan?
So John is a military. He's a former on Army. John, you want to answer that question?
So historically, veterans under TRICARE, they've got a very lucrative health plan, and there would be no reason for them to switch over to MAPD or Medicare supplement plan, right? I'm not sure if it's current. I know that a lot of the agents are kind of advised not to touch members with TRICARE.
Historically,
you may disrupt. Right, you may disrupt their current action plan that may be associated with their providers through TRICARE. But anyone with any other vets outside of not having TRICARE, we are encouraged to try to reach out to them.
Okay.
They may utilize the VA, and they also have a secondary fallback to the Medicare Advantage plan that we were trying to outreach to these members.
Just to caveat on that one, John, you had done a lot of camps at the Long Beach veteran place, and you had enrolled a lot of veterans. Walk us through how you had helped a lot of the military at that location. Is that Long Beach?
Long Beach, yeah. So we used to coordinate with
Anthem.
A couple of the health plans, right? Particularly Anthem. We would go out there to the VA and set up a booth, and we welcome all members, all the VA's veterans, to come out and talk to the agents, and we would try to educate them on, being able, because they're vets, they're not only entitled to veteran benefits. We're trying to educate them and making sure that they understand that you can also sign up with a health plan, with an MAPD plan. It's just basically giving them a secondary fallback in case it's taking forever to be able to see a specialist through the VA. Well, if they're not able to to be referred to a specialist through the VA, they can say, "Oh, wow, I've got Anthem as my secondary insurance company, and I can go ahead and schedule a visit with my primary care doctor. And then if I need to see the specialist, he would then refer me to the specialist through the referral process." But a lot of the benefits through these health plans, especially here in California, or Southern California, I should say, are very lucrative. I mean, there are most will have zero copays, right? The only thing that the members will have to be required to pay will be their Part B, and sometimes they may not even have to pay the Part B. They could be Medicare, Medi, what we call Medicare, Medi-Cal, eligible. So, it's just talking to the vets and making sure that you have access to the Medicare Advantage. You can utilize the Medicare Advantage if, for whatever reason, you're not able to be seen by the VA.
So I had a pleasure of servicing the veterans as well for many years. A lot of my veterans love what they have, having to go to another specialist, as going to Cedars-Sinai, going to UCLA, which is the helpline provides. So UCLA, it's partnered with SCAN. Cedars-Sinai, it's with United Healthcare. So they see the value of having two coverage, whether if they want to go to the VA or they can go to the top notch, which is UCLA or Cedars-Sinai. And my clients are so happy. They said for many years didn't know that they could have that options. So there you go. You reach out to the veterans. We want the veterans to be aware of this, and we want to help the veterans. John, there's another question here. What if someone is already undergoing treatment? How can they switch to Medicare without fearing it will disrupt their current treatments? For example, ESRD. So ESRD, it's very delicate. We know how delicate that thing is. Is they have to get their dialysis treatment. I was one of the person had worked for a dialysis company in the past. What you really need to do is do a thorough. You need to check their provider, make sure that part of the plan. You have to ask them questions, and you have to tell them that they are going to be assigned to a plan. A lot of this plan now are contracted with all the dialysis centers, such as DaVita, the other company that they're competing. There's only two companies in California. That the biggest one, which is number one, I think, is DaVita, and the other one start with Precis, something like that. So just having the thorough, having that conversation and making sure that you check everything that they need before you enroll them on a plan. The transition will be fine. You just have to do your thorough analysis and making sure that they are understanding what they're going to be going to a plan that the dialysis center are participating in that plan. So it's almost like it's the transition is really almost not a lot of change, to be honest. 2021 is going to be very exciting for the ESRD members because they could shop in many plans. However, right now for 2020, there's only two plans they could choose. For 2021, you have unlimited of a company. These ESRD members and patients are now could shop with multiple plans, and we want to help them.
Awesome. Hey, gentlemen, I wanted to keep this short, but I really appreciate you guys coming on and kind of sharing your insight on Medicare. I really wanted to have some awareness out there that Medicare, that open enrollment is coming up, and get them thinking about what they want to do for those who are turning 21 or 21. Wow, it'd be nice to turn 21 again. Those turning 65, and have them having options on what they can do. If again, I like that idea. John said, hey, research Medicare.gov, I believe it was. And then, just make sure you're getting all the information available to you so that you can make an informed decision. I think that's the most important thing. You want to make sure that you're getting the most bang for your buck, so to speak. And Edward, I really appreciate you guys coming on. If anyone needs to contact you, do you have contact information? How can we get a hold of you should we have further questions?
So we have the website healthchoiceinc.org.
Awesome.
That's our website. We also have numbers that we could share to you later on and put it on your podcast. I want to make the aware of the seniors that within less than 5 days, we are going to be going to one of the biggest event of Medicare, which is the open enrollment. It's so exciting. People will be able to change their plan if they're not satisfied with their plan or the plan doesn't fit them anymore. As you know, people, health change. If someone could be healthy right now and then the next day could have a heart attack and with zero medication, now with 4 different medications, that is the time from October through December the 7th is the time to shop for the plan and say, you know what, I want to be with this hospital from now on. I want to be with this plan, because this plan offer transportation, which is I really need. This plan I need gym access. This plan I need the dental access. This is the time really to reach out to people with health choice to communicate with us, finding the right plan for you.
Awesome.
And we will sit down and we would do our analysis. We would find the plan that is right for you. So reach out to us. We've been in the business since 2010. Call us at 1-844-637-2063. That is 1-844-637-2063. We have Spanish speaking, Tagalog speaking, Korean, Vietnamese. We want to serve the community of Los Angeles, not only the Los Angeles. We are a national company that we have Texas, California, Nevada, Arizona, Kentucky, New Hampshire, Nevada, Florida, Washington. If you're out there, you just need questions, please reach out to us. We will be glad to sit down with you. John has been in the business for a while. We normally take our time and we take this seriously, sitting down with the seniors, because we know one of these days we are going to be seniors as well, and we want to get the same service what we're doing now.
Awesome. Yeah, I appreciate you gentlemen coming on. John, any parting words?
Yeah, like Eddie alluded to, just make sure that our people out there are able to make their informed decision based on what their needs are, and hopefully they will be able to utilize the services that some of our agents were able to provide them.
I love it. I love it. Thank you very much. Thank you, gentlemen. Again,
Thank you.
Thank you for coming on Unscripted. We may have more shows like this in the future, so I really appreciate you guys. Thank you so much, and that wraps it up for Unscripted.
Thank you for having us.